My experience with the health system begins as individual hospitals, first with Cherry Hill, where my dad practiced for many years. And then we were told when I was 17 he's building a hospital at Washington Township. We saw the area, we couldn't believe that a hospital was going to be built there. Subsequently, I actually at 17 was doing pulmonary function studies, blood gases, doing things that a 17-year-old should never do, but I actually did them very well, and frankly, I think the statute of limitations is gone, so I'm not very worried about it.
He took an approach to treating stone disease, which is a bit unique, and spends a lot of his time with patients with kidney stones. Kind of a difficult thing to do, but he's quite good at it.
I've served many roles at the hospital. I am very proud that as chief of surgery, we were able to build new ORs at Washington Township. I'm proud that we were able to build 2 more floors at Washington Township, with, mind you, the promise of the board to continue to build 2 additional floors.
The last couple of years, when he became aware of the Employee Assistance Fund, he worked tirelessly with medical staff to make a very, very big donation to that fund, and that continues every year. He has always viewed his role not just as a clinician, a surgeon, and administrator, but also as an advocate for the Kennedy Associates. And I know that he feels very, very close to the nursing staff.
Oh, absolutely. In fact, the nursing staff gave him an award when he was chief of staff, and the title on the award was Voice of the Staff. So he has been incredibly instrumental in carrying their voice in clinical decisions.
Rob has always had time for the community. He's been involved with lectures in various places in the area, supporting various activities, and really has encouraged all of us as partners to do the same.
Very hardworking, very driven, very accessible, dedicated, very loyal to Kennedy.
Very passionate about what he thinks are primary concerns and strategic initiatives for Kennedy.
I want to thank my family. Nancy, my wife, has put up with me. It has been work for her, both through my recent illness and through everything I have done with the Kennedy Health System. It's time-consuming, and she's been a trooper and my best supporter. My 2 children, there have been many nights when Adam and Jenna didn't see me because I was at meetings. But they knew it was for an important purpose, and they were willing to give that time. There are those at the Kennedy Health System who I've known my whole life as a baby and as a child, and now as a physician and an adult, who have been my best allies and have helped me through some difficult times.
I think Bob's tireless support of Kennedy has been remarkable. He's devoted quite a bit of energy over the years to committee work, to the residents, to the employees of the hospital system, and I think there's nobody who's more deserving than Rob for this award.
I think Dr. Barsky deserves to win the Beacon Award because of his commitment to quality care, his commitment to Kennedy and its reputation in the community, and his compassion towards the Kennedy Associates.
I agree. I actually kiddingly call him Dr. Kennedy because when he is in the community, we are first in his reference to quality care and clinical practice and our contribution to the community we serve.
Our work has only just begun. There's a lot more that Kennedy needs to do, and a lot more that the community needs from Kennedy. And I hope, as a physician of the health system, I can be an active part of that.